Dr. Kevin Kavanagh, retired physician from Somerset, Kentucky, and founder of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
How are you today?
Doing pretty good, bright and chipper.
Well, you know, all the news stories, and I'm sure you're online all the time looking for this stuff, have sort of the whole Omicron, the whole COVID-19, other than some of these mask stories, has kind of gone away because they've been overshadowed, of course, by the war. And it's kind of interesting how we go from sort of total attention to one thing for a long, long time, and then we shift pretty quickly when something as serious as the Ukraine war is. And I guess we should start this morning by talking about the fact that the governor has lifted the state employee mask mandate and has loosened Kentucky's masking recommendations, and then our mayor, Lexington Mayor Linda Gorton, lifted the mask mandate for city government buildings. What's your reaction to that, number one? And number two, as you have said on this program before, just because it's no longer mandatory doesn't mean that you can't wear the mask if you feel better doing so.
Well, I agree with you 100%. I think it's a little early to be lifting mask mandates in Kentucky. Remember, Kentucky, compared to the rest of the nation, is not doing very well. The CDC recently relaxed their masking guidance. In that respect, I think that I can see why we're relaxing, but if you look at the data, even with the CDC's relaxed guidelines, 80% of Kentucky is still in the red. And in the red, according to the CDC, you should still be wearing a mask in indoor public spaces.
Now, what is in the red? What does that actually mean?
Well, that's a combination of cases in your community and hospital capacity. And they're really starting to look at hospitalizations. Now, of course, I'm a little concerned about that because hospitalizations is a lagging indicator. And by the time you see a spike in hospitalizations, you may well be in for several weeks of spiking because the cases will continue that have already started to occur in patients. And I think that it's a little bit too soon. I mean, it's possible with the stealth variant, when it comes in and it starts to spread, that we could see another spike because, as you know, Jack, the vaccines and even the boosters are starting to wane. So we have to view those as a layer of protection, not as a panacea against getting an infection and being safe no matter what you do. And so I still think we should be following public health guidance at this point. If we were living in another state that was all in the yellow or in the green, things would be different, but we're not quite there. Now, the good news is rates are falling precipitously. So I think we're talking a matter of maybe even days as opposed to weeks, but yet high viral rates are still a high viral rate. And at this point, I would advise people to still be masking indoors. Certainly, if you're immunocompromised and are high risk for COVID-19, I would certainly be following public health advice.
Okay. Let's go to this limited protection of the 2-dose vaccine to Omicron and the 3 doses waning over time. What can you tell us about that?
Well, this is now about the 3rd or 4th article on this, and it appears to be waning over the course of months. This article was published in the New England Journal of Medicine just a few days ago, and it looked at both the AstraZeneca vaccine and the Pfizer vaccine. And of course, when you have those two vaccines studied, you know the articles out of the UK, which this one was. And so looking at the Pfizer data, and this is against symptomatic disease, at 2 to 4 weeks against Omicron, it had a 65% vaccine efficacy at preventing disease. But this dropped to 8.8% 25 weeks or more. And so again, not very good as far as lasting protection. Layer of armor, maybe this will limp you along. In fact, it will until they get a Omicron-specific vaccine out. So I would suggest getting vaccinated but still wearing a mask. Now, 3-dose vaccine, that's, of course, your 1-dose booster, in other words, your first booster. and that vaccine effectiveness increased to 67% at 2 to 4 weeks after the vaccination. And then it declined to 45% vaccine effectiveness at 10 weeks after the booster. And so again, it is declining. And even if you get a booster, you're looking at several months of protection. And after that, you're going to really need to be looking around for an alternative. And I'm hoping that we'll get a Omicron-specific vaccine out by that time. Now, none of these effectivenesses are 100%. And because of that, I would suggest continuing to wear masks indoor setting when you're at high risk of spread. And if you also want to add the new data out on the vaccines for 5 to 11-year-olds, this I think is kind of disconcerting. The article is somewhat hard to read because, again, this vaccine authorization only took place on October 19th, 2021. But they've noticed vaccine effectiveness against infection dropping from 68% to 12%, and against hospitalizations dropping from 100% to 48%. And this is occurring over a course of maybe 6, 8, 9, 10 weeks. And so, again, it may be a layer of protection, but not as good as we've hoped. And of course, in this age group, they're at low risk for hospitalizations. What I was hoping is that this would really decrease the chances of the child bringing home the virus to the family. In this case, I'm concerned because even if your infectivity drops to, let's say, where you're only infectious 1 day of the week out of 5 days, when you go home and see that person every day, there's a high likelihood of transmission in that sort of a setting. So I think that we've got to be concerned. We still should follow public health advice, and certainly if we get another surge. And that's something we need to be on the lookout for.
We've got some text to get to this morning. Doctor, this one says, please ask the doctor if there is data supporting an uptick in autoimmune disease subsequent to the vaccine.
There has been some data which indicates that rarely can happen, but it is more likely to happen with the infection. And that's the thing. The infection is going to be much more dangerous in that regards. And so if you get the vaccine to ward off the virus during these peaks and surges, you're probably in a better shape. Even if it's only 50% or 30% efficacious, you're probably in much better shape than if you're going to go out and get the infection. Because remember, you can get the infection multiple times with these variants, and that's been demonstrated. And I know a number of individuals that have had this 2 times, and my son has a friend who's had it 3 times. So by far, you're much better off getting a layer of protection by getting the vaccine and also wearing a mask in indoor settings.
Okay, let's see. This other one is a little bit more lengthy. This is from Kathy. The word optional. The word optional means I will still be wearing a mask until the numbers are better. Disappointed at our local school boards ignoring public health department guidelines, do not follow recommendations of science and healthcare advisors because they are not disciplined to finish the fight versus the pandemic challenge. Looking at Woodford County Board of Education, many of the counties adjacent to Fayette County have opted out of the mandatory mask. But now Fayette County, as you probably know, Doctor, decided to continue with that for the time being.
Yeah, and I would go along with that. You need to remember that children can be immunocompromised. Many are when they're in the school setting. If you have, for example, diabetes, and also if you have asthma, what you don't want to get is Omicron. And so I think you still need to continue public health advice. Schools absolutely need to be upgrading their ventilation. That should be a non-controversial thing of increasing airflow, trying to decrease spread. We have a very good video up online from our last meeting at Health Watch USA of a occupational health nurse who talks about the interventions and the multiple layers of interventions that her school district in Massachusetts did. And this include ventilation, masking, testing. They even did surveillance testing, pool testing, case tracking, of course, masking, and encouraging vaccinations. And so multi-layered approach is best. And one of the things is this: if you've got an immunocompromised disease, you can make a choice of whether or not you want to go to an indoor setting. Even buying groceries, you can get curbside pickup. But when you send your children to school, you have no choice. You want your child to go to school, but you want it to be the safest place possible, because if that child picks up the virus, they could easily come back to your family unit and spread the disease. And as I've said before in this show, we've had at least 3 family units in my family that this has happened. And so we want to make sure that we have these schools as safe as possible for our kids. And our kids shouldn't be the point people for a debate on politics. We need to really concentrate on good science.
This is another one of those ivermectin folks, or hydroxychloroquine. Why does the doctor not promote early treatment and the therapeutics of those 2 medications?
Well, because so far there's not any conclusive evidence that they work. And in the case of hydroxychloroquine, with the virus attacking the heart, it may be dangerous, especially if you combine that with zithromycin. There have been multiple randomized controlled trials with hydroxychloroquine which failed to show an effect. And we've had a recent one with ivermectin, which also failed to show an effect. If you're going to get a therapeutic, which I do encourage, concentrate on the monoclonal antibody products, on paxlovid, or on the Merck pill. Those are the 3 therapeutics which have been shown to be effective and are available on an outpatient basis. And in some places, you can also obtain Remdesivir.
So bottom line is, does it look like people that have gotten 2 vaccine shots and then a booster are going to need another one? And when would that be appropriate if that's the case?
Well, I think they're going to need another one. And I think according to the data, you'd be looking at 5 to 6 months out. But hopefully by that time, we'll have an Omicron-specific shot out. Mm-hmm. I think this, we're going to have a 4th booster in the fall that you're hearing from the federal government is just kind of, it's just happy talk. I have no idea where they got that data.
Okay.
Yeah.
We're out of time, Doc. Hey, thanks, and we'll talk to you on Monday.
All right.
Have a good weekend.
Thank you, Jeff.
Thanks.